Hi everybody. I decided to come back a little sooner than I thought because I got a little bit inspired by watching other people's videos and people responding to my video, and I'm super glad that people are doing their vlogs and documenting the whole pre-op procedures and what you had to go through for that, because that's something I didn't cover. And I have to say that my journey to have this surgery was about a 3-year long journey. A year of that was because I decided to have a baby and to have my beautiful son, who's 2 years old now. But the rest of the time consisted of getting clearances from cardiologists, a pulmonologist, doing sleep studies, psychiatric clearances. I had to lose a certain amount of weight to qualify, and then I had to get all the blood work and pass that, and then they tested me for a bacteria in your stomach called H. pylori, which I tested positive for. So I had to do triple doses of antibiotics for 10 days, and it was kind of nightmarish, but at the same time, it's comforting to know that all the bases are being covered and that your chances of doing it as safely as possible are there. So my surgery, I arrived at the hospital I think at 5:45 a.m. and my surgery was scheduled for 7:30. And the time I got at the hospital before my surgery up until I was put out was probably the most nerve-wracking few hours of my life. And if I didn't know that it was going to save my life or add years onto my life, I probably would have turned around and walked out. It's not an easy thing to do, and it's scary, and you're rerouting your whole insides and changing your whole physiology. It's just not natural feeling. And at the same time, I felt a lot of disappointment in myself for even letting it get to this point in life to where I felt like I had no other choice but to make a drastic decision like this. But it's one of those things I had in my head, I have to do it, I have no choice. If, for anything for my son, he's very active, he's a 2-year-old boy, he needs parents that can keep up with him, and sometimes I'm limited, really, and I just can't do it anymore. But on a happy note, I'm very excited to watch everybody's journey, and everybody who has surgery scheduled, I wish you the best luck. I hope we can go through it together, because it's very encouraging to see other people going through the same things. Every facility and location is a little bit different, so maybe what happened to me won't be exactly the same, but pretty much when I woke up, I wasn't actually, now I'm remembering, my worst complaint was I had pain in my left shoulder, and it was a real aching pain, and they told me that it's from the gas, because anytime they do an abdominal surgery they fill you up with gas, and it's just the gas trying to escape your body. And that went away after a day. For the first day or two they had a morphine pump, which I used because it's a lot more painful than I thought it would be. I guess I was kind of thinking the only other surgery I've had is a C-section, and compared to this, that was nothing. And first I just thought that it was going to be more like the C-section, but this is a lot more involved with your abdominal muscles and things that just hurt, especially when you're a large person and you really have to strain to get up and pull yourself up, and you feel it. And not to deter anybody, because it is well worth what you're going to end up with, which is a happier, healthier, longer life. So it was kind of difficult for me when I came home. We had a lot of company come and visit, and of course when my family came to visit, the thing to do was to go out to dinner, and I'm still on full liquids. That's all I can eat is full liquids. So we went to a restaurant, and it took me a couple minutes to be okay with it mentally. It really was like, oh God, it smells so good, it looks so good, and I ordered soup, and I was okay with it after a couple minutes. I accepted it, and this is what it is, and it's for the best. And then after that, it just kind of was awkward almost because everybody's eating and enjoying their food, and you're kind of like on your soup, and it's just a little bit awkward. So a couple days later, my fiance's side of the family came to visit, and out to dinner again we went, this time to a buffet. At least I had more options to choose from. I ended up, this is a little later on when I starting a little bit of pureed food, so I had some mashed potatoes with a little bit of gravy on them, and that was my dinner, and the restaurant didn't charge me, so that was good. Anyway, this is going a lot longer than I thought. I'm just getting a little carried away. But basically, I had 6. My surgery was on laparoscopically, so I had 6 lap sites that were covered with steri strips. There were no stitches or staples or anything on the outside. I did have some deep tissue stitching that I'm gonna try. I don't really know how to put a picture on here, but I have a good picture of when I first came home. You'll see what I mean if I can get it on here, of where they pulled the stitches a little bit too tight internally, and it caught some of my outer skin, so it caused a real big dent on my left side, and it's come out a lot because the stitches are slowly dissolving, but that was a little scary looking, and I was kind of wondering if it's going to stay like that forever. And I had a drain, which I went home with from the hospital, and it was removed about a week after surgery, and that's a little unpleasant, but it's nothing too drastic. It's just one of those things that who wants to do it? You don't want to, you just do it. So anyway, I look forward to watching everybody's journeys. I'm real excited for myself and for everybody else and everyone who has it scheduled. I know your excitement that you're feeling and the anticipation, and you're nervous and happy and excited all at the same time, and you just want to get it over with, because it's something you have to work so hard to get. So good luck, and I'll talk to everybody again soon, and I look forward to watching all your videos in the meantime. So take care, good night, bye.